around 7, half 7.
Sorry.
7, half 7, so they are kicked in. So slowly your mind kind of from a kind of, because of vata, from a very active mode, you want it to calm down a bit. So if you're doing your evening program like TM, so you can take it around that as well. So you need 2 to 3 hours to work. It's good idea that you're taking both of them together, one of each. If one of each is working, perfect. Otherwise, you combine one of the piece of night with it. So that they kick in. There's just simple difference of some herbs in them. There's not a big difference. Blissful sleep, we mainly give it for kapha people, basic. The deep rest is for vata pitta. So you are actually having all of the 3. There's a slight difference. As I said, blissful sleep, basic might be more ashwagandha based, and deep rest will be more brahmi and shankpusvi. Those are the cooling herbs for pitta. And then the piece at night might be slight valerian and the licorice, that kind of grounding herb. So you combine 3 of them together. If 2 of them together working for you, perfect. Just 2 hours before the bedtime.
Great, Raj. Thanks very much for that. Again, worth looking at Dr. Brennan's video on sleep, because there's more we can do than taking tablets to help us get to sleep. Massaging your feet with sesame oil, doing a set of asanas, lots of different things about getting ready for sleep in the evening time. So that video on our YouTube channel. And please, everybody, subscribe to our YouTube channel if you can, because every time we put up new videos there, you'll get a notification if you click the notifications, you know. Renu, thanks for that. That's Vata, why I didn't start that recording, because I spent the whole day on the computer and my Vata is imbalanced, and that's why I didn't remember to start the recording. But anyway, we missed some gems of answers there. But anyway, what can we do? So this is an interesting one from John C. I think we probably have different opinions on this as well. There's a lot of talk in the TV in the UK just now about the health benefits of cold showers. How does Ayurveda view this practice, please? I'm not too sure it has a definite view on it. But anyway, Charlie, maybe do you have a view on people taking cold showers?
Cold showers, actually Ayurveda doesn't recommend cold showers because it increases more of vata. So it might cause more of vata imbalance. So it is always better to have warm water shower. And in only for hair wash, try not to have very hot water shower. But for your head wash, you can go with almost cold water or warm water. So that is what Ayurveda says.
Okay, it's interesting now, because I'd say Dr. Brennan would have a different opinion on that, and I probably have a slightly different opinion as well. I'd agree with you in general that I would tend to have a hot shower, but then I was reading a lot about the benefits of having just a cold shower at the very end, just for, you know, maybe 30 seconds or 20 seconds, and it actually, I'm not too sure how strong the evidence is, but the theory is that it ignites your immune system, because it's kind of like a shock to the system for that few minutes, and it just ignites your immune system. And I suppose it's a bit like swimming in the sea. I mean, probably it depends on how vata you are. Actually, I'm quite pitta, so I quite like doing that. Raj, would you have an opinion on it, or?
Oh yeah, I agree with you. Yeah, because it's a lot of scientific research is coming around it, because the cold shower, even cold water swim, help with the vagus nerve. So especially people like yourself all day on computer and just too much stimulation. So that kind of shock just help. But if you're very strong vata, like Dr. Chitrali's point, then maybe you have to be not taking it every night, kind of you and alternate.
Well, I'd never take it at night. It would be in the morning anyway. But
some people do say, some patients say, oh, I take a cold shower, it helps. Some say, not really. So I think it varies. It's again an individual approach. If you're very pitta, you're going to benefit from a cold shower a lot. But if you're very vata and you're into vata age of your life, then you just, like you said, just a sprinkle after you finish the shower. Yeah. So just your body is going to release, your heart is going to pump a lot of blood to the whole system. So that's quite relaxing. In that sense, it's very rejuvenating for the whole nervous system. So just look at it, who you are, what is your body type, and then you go for it. It may not be suitable for all the 3 individual, and depends on what's going on, what the balance is. So.
Yeah, so again, it's about being self-referral. It's about being, if you find you're taking a cold shower and your bath is completely, and you're shivering afterwards, and that's definitely not good. That wouldn't happen to me. I just take a cold shower, there'll be a little shock, and then that'll be it. I get out, and then I don't feel my vata going out of balance with it, you know. But just be self-referral on that particular one, I think, you know. So this is from Usha. Hello, doctors. Any suggestions for localized periodontal disease, patterns of bone loss under tooth, and generalized marginal gingival.
Gingival
Yeah,
inflammation.
you go ahead with that, Charlie, there if you want to.
Yeah. So basically for gingival inflammation or even for your oral health hygiene, you can even gargle with squish your mouth, oil pulling. It is called as oil pulling. So you can do it with like sesame oil, or even triphala decoction will help you for retaining that inflammation, or it reduces that inflammation as well, and keep your oral structure well. But again, for bone loss and under the tooth, for that, the supplements will be more beneficial. And if you have any gingival inflammation on and off, so even clove oil is very good for that. So even if you apply clove oil to your gum, and even to the teeth where it is getting decayed, so that also helps, along with rock salt. So anyone wants to add in anything?
We have, if it's still in stock, wonderful gum oil. That's
Gum
like,
oil.
Yeah, we have it. Yeah, yeah.
perfect.
We have gum oil in stock. Yeah. So
Perfectly. It has clove and other oils in it. So
yeah, no, the gum oil is fantastic, and
Yeah.
it's not expensive. It just comes in a little squeeze bottle, and just put
and
gum
good,
oil in, or just look in the shop under dental care. But it's like we've mouthwash, we've tooth powder, we've gum oil, and we have Ayurvedic toothpaste as well, which is made up from herbs and chalk and things like that. All of those products are great.
If you're losing the bone, then you might need a bit of fluoride as well in your toothpaste. So I would say the Ayurveda toothpaste plus your good fluoride-based toothpaste. Keep both, and then have the gum oil and good quality vitamin C because of the inflammation. So you need your immune system. So you consider that as well.
Okay.
So amla berry is perfect, wonderful for that. Amla powder.
Well, amla berry MA1, or we have the cytoplant vitamin C as well.
Amla powder.
So I'm going to give the next second question to Raj. So I'll give the next one to Naheed. Is bloodshot eye due to allergies? I have dry eyes and use drops.
Yeah, so bloodshot eyes can be a sign of allergies, and there can also be a sign of if you're rubbing your eyes too often because your eyes are strained, looking at the screen or something like that, then sometimes it can lead to subconjunctival hemorrhage. I know the term is very scientific. It's just that the minute vessels in your eyes, in your conjunctiva, that gets ruptured, and you might have a bloodshot eye. But most commonly it is seen with the allergic condition. So do attend Dr. Chatrali's webinar to see how you can manage your allergies. And you can apply Triphala wash water, like take a glass of hot water at night and soak a tablespoon of Triphala powder in that. Early morning, try to strain it with a very fine cloth and just, splash the water in your eyes. Do we have any eye drop? No, right? Like at the moment.
Eye droppers? No, I don't think we have, no. But you get them in a chemist shop, I think.
And if you're comfortable having milk, then you can have golden milk. Golden milk helps to combat allergy. And on top of that, we have, I think, Shitapala, no, we don't have Shitapaladi, right? We have Avipala.
Sitopalati churna we have, yeah.
Yeah, Shitapaladi churna is a very good anti-allergic mix of the herbs. So start taking that, maybe half a teaspoon with 1 teaspoon of honey, or maybe 1 teaspoon of ghee, and that will help to reduce your allergies. And with the local wash, it will go away in just 2 or 3 days. Don't worry about that. But if it keeps coming, then you really need to check that your allergy is like in which condition, and you really need to work hard and just see like 2 or 3 months in a regime, so that your histamines and your natural allergic level come down to normal and you don't get it again and again.
Yeah, and you might consider doing the spring detox next year. Might be a good thing to do as well. But definitely do Dr. Tritelli's webinar on the 8th of June. Dr. Naheed, if you could just type some of those things, just reply to Jeannie there and just type in some of the products that you mentioned, because probably won't remember all of them. So Raj, for you, I know what the answer to this is. George Hollis is saying he still has some herbs left from the detox. I'm pretty sure he can just go ahead and finish them.
Yes, yeah, yes. Very good, John. Well done. You did a great job. Hope you're still benefiting from it. Yes, finish it. Exactly. So depends on how many are left. Just taking a day or two.
So there's one here. I
It's
can't.
one of each. Yeah, perfect. If it's one of each, just finish it. Yeah. So just do one liquid day and take the herbs and finish it.
Okay, so there's another question about making shatavari ghee. I don't think we're going to answer that one actually. Yeah, but probably just Google that, Maria, would be the thing to do, you know. Yeah, just Google that would be the thing to do on that one, you know. Which would be the best, installing a filtration system or using a Brita filter? Yeah, that's a question. People will give you different answers. I was told by a guy who specialized in water just to use the Brita filter because you replace it all the time. You're replacing it. He said the problem with the installed ones is that you're supposed to replace part of it, but people forget to replace it. Now, I don't know how true or how untrue that is, but I just used the Brita one. And I know Dr. Brennan has this came up on the talk before. Dr. Brennan has one that's installed, but Dr. Brennan's probably very organized and remembers to replace the parts and all that sort of stuff. But that was the advice I got from the guy anyway, just to use the Brita filter, you know. Advice on genital herpes, please. I have vata pitta imbalance. I've been using homeopathy tunja, but I have some outbreaks recently. I don't know whose turn it is. Rajvinder, do you want to take that one?
Poppy, that's a very strong pitta imbalance. If you have a breakout, and again, as we were saying earlier, this is the season for it, and even the coming summer. So start taking your cold showers and seawater, clean seawater swimming, and looking into all the cooling foods, cooling herbs, coriander, mint. So cut down on any spicy food you eat, any fried food you eat, and just on the top of the shelf, like amla is very cooling. Nowadays, amla is available in the season as a fruit. If you have any Asian store around you, look for it and eat lots of amla. Indian gooseberry, we call it. And otherwise, get amla powder from Knoll and take a teaspoon every day. We have some herbs. I think simple herb, you can start with a radiant skin because of neem and all wonderful pitta blood kind of cleansing herbs in it. So radiant skin, take a kind of maybe two morning, 2 evening. So see how they'll go, but definitely need to kind of calm down your pitta.
Coconut water, would that be good?
Yeah, anything that is cooling,
Anything cool.
coconut water, coconut milk.
Yeah,
coriander,
avoid alcohol as
water
well.
or-
Alcohol is going to be very irritating.
Yeah.
fennel bulbs, cut down on sugar, fried acidic food, chilies.
Even pomegranate should be good for
Yeah.
that. And
Yeah.
if locally you want to apply, you can apply just the cow's ghee and mix it with licorice. So
Yeah.
that will also help to calm down.
Licorice powder, mix it with
Licorice powder mixed with ghee.
Okay. Yeah, well, we have all of that. So the ghee, you can get ghee in Asian stores now as well, you know, and licorice powder we have on the website as well.
Licorice, yeah.
So that's just topical application for that. Okay, and Vincent says, would you recommend red rice?
You mean red rice yeast or just red rice to eat red rice?
The red rice yeast if you want to reduce your cholesterol levels, but red rice,
yeah, absolutely. If you can digest them, they're quite tricky to cook. Very hard.
Yeah, it is quite tricky to cook. You need to cook like brown rice. You have to soak it for a few hours and then cook it.
Yeah, definitely take it. It has more nutrition to the white rice, so you can take them. Yeah.
Okay, what is able, please? I don't know what able is. What is able? Did someone type that in?
Yeah, so avaleha, the literal meaning of avaleha is which you can lick. So any form of medicines or herbal preparation which is coming in the form of paste, which you can lick, is called avaleha. One of the example is chavanprash. Chavanprash is a form of avaleha preparation. And there are many more examples, so I just gave avaleha.
Okay. So Susan says, I use a Biosera alkaline water filter jug. Are you saying this isn't a good idea? We're not really saying it's not a good idea. I don't know what a Biosera alkaline water filter jug does. So I think that if it alkalizes the water, I think Dr. Rajvinder was saying, and I would agree with her, that I don't particularly feel that that's a good idea. But anyway, I'm sure there are people who would vehemently disagree with that, you know. I've seen stuff on the internet, people swearing blind about the benefits of alkalized water. So you have to make up your own decision. But from an Ayurvedic perspective, and there might even be Ayurvedic doctors that wouldn't agree on, Ayurvedic doctors don't agree on everything, so you just have to do your research. But from our perspective, I wouldn't alkalize my water anyway, So Judith joined. Hello, I've been advised to give up wheat and dairy due to dry skin and eczema. Really difficult, but I am reducing them. Is it a good idea to reduce these slowly as previously advised by Ayurvedic practitioner? Thanks so much. Always a good idea to make changes slowly. There's a routine for it. In one of the webinars we did on the daily routine, we explain how to make changes, and you make them how to cut out what you want to cut out and introduce what you want to introduce. Like if you're giving up coffee, you don't just give it up. You do it gradually. So it's always a good idea if you want to give up those things. So so I would advise give them up. Our advice would be, I think, to give them up gradually. Would that be correct, doctors?
Slow and steady wins the race.
Slow and steady wins the race. Exactly. So these are jumping a bit.
And next is Mary Armstrong. She's asking,
what would you advise for persistent yeast infection, which began with localized HRT treatment for severe atrophic vaginitis? Many thanks. Does anybody want to take that?
You need a consultation for that, Mary, because you have to go through a lot of questions around it. You need to know your body type, might be kapha, and certain diets need to be reduced and all that. But if you started after HRT and it's very bad, we have MP6 powder. Yes, that will help, just half a teaspoon. But again, it's a very strong powder. I need to know more before you start taking that. So
okay, so really that warrants a consultation with one of the doctors. Yeah. Okay.
Yeah.
Okay. What is the reason for salty cravings after food and sometimes sugary? Probably a lack of six tastes in the food. Dr. Struteli, any ideas there?
Yeah. So salty, usually it is like it is time for your body to detox. So that is one of the sign which the tongue sometimes give when you have a salty taste and you have like a lot of accumulated toxins in your body. So that might be one of the thing. And the second thing is, yes, if you're like having overly sugary food, or you are not having proper meal on time, that might also accumulate more of toxins and it might increase more of salty taste on your tongue. So it is the layers which are formed on the tongue, basically. What are the other means? What other doctors feel? You can just add in.
You might have low blood pressure, Nita. That's probably causing, because it sounds like Indian, and Indian have a lot of salts in their diet anyway. So start using Himalayan salt if you're using white refined salt, and then maybe more salt kind of that kind of absorb the salt body better, like spinach soup. Include rocket in your diet, watercress. If you're familiar with these kind of herbs, use them. Make sure you hydrate yourself better. Like Dr. Chichali said, the layers are formed, so start doing the tongue scraping. The taste buds get a bit refined. See if all of that help you.
So Siobhan says, I swim in the sea every morning, so is this increasing my vata? But Siobhan, you'll know, be self-referral about it. You could be a very pitta person and it might be very good for you to swim in the sea every morning. Do you enjoy it? Is it exhilarating? Is your vata gone out of balance? Are you worrying all the time? Have you got a lot of thoughts going on? Can you not sleep at night time? Are your joints crackling? All those things are increased vata. So just look at that. Like sea swimming is very, very, I sea swim myself. I absolutely love it, but I have a lot of pitta in me. I just love swimming in the sea. So I don't go in the morning time. Well, I do sometimes, but not every day. But just depends. If you're getting an awful lot out of it, then stick with it, But if it's causing problems, if you feel your vata is out of balance, then maybe you need to look at it,
Sonia's tip is very good. Thanks, Sonia. Hopefully somebody can use. She said massage the big toe for 30 to 60 seconds, help with the sleep. Great. Good reflexology point.
Sonia says hot water has an acidic effect while cold water has an alkalizing effect. I'm not sure about that. I have to take your word on that, but I'm just not sure about that.
Yeah, but hot water, I'll just include few things like hot water, it increases more of circulation basically. So why in Ayurveda it recommends to have warm water or hot water shower just to improve your circulation throughout your body basically. And that is the main thing. And it keeps all the doshas in place, like the vata, pitta, and the kapha. All the three doshas are balanced in that way.
Yeah, actually, it's advised to sip hot water throughout the day. Just, it doesn't have to be boiling hot or anything like that, but it can be a good thing to do that. Sorry, Nahid.
Yeah, I was saying that skin is the organ of vata. So if anything is vata, too much of cold thing will not be advisable as per Ayurveda.
Okay. So do you have any advice to stop snoring? My partner snores and also has a hearing impairment. Is there a connection between hearing and snoring? Don't think so, Shirley, but did we have some things for snoring? That came up a lot in the other. Go ahead, Nahid, there. I see you nodding your head.
Yeah, so the best solution would be start sleeping in any other room if that possible to have a good night's sleep. And if you can't do that, then start telling him, because of the course, the importance of nasya, the importance of oil pulling. So anything which is associated around your nose region, around your throat region, oil pulling and a nasya can help. Ask your partner to sleep on either the left side or the right side. So the person, when they are sleeping on their back, they snore more. So, and snoring and hearing loss, there is very faint kind of research work is there that if a person keeps snoring for years and years, they might have a hearing impairment because of the snoring, but there's a very faint kind of research. So I don't want to comment anything like to be very sure on that. But I would definitely suggest do breathing exercise, do nasya, sleep on your side, right, left, and do oil pulling. This all things can help to reduce the amount of snoring. Yeah.
Yeah,
If
and the
any other doctor
pranayama, the
want to add
breathing
anything.
exercise might free up that area as well. And it is, you're correct. It's very, very important that you get a good night's sleep. So, I mean, the person who's listening to the snorer is suffering more, so it's, if needs be, have another room that you could sleep in, because, if you're going night after night without getting good sleep, but then look at these things to see if they make a difference as well. And certainly sleeping on your side as opposed to your back may
He
help.
might be more kapha, so worth looking into kapha balancing, because sometimes extra production of wax can cause hearing issue, and that's kapha. And snoring is also very much a kapha problem. So maybe Shirley, you need to see, is he more kapha? Give him less dinner.
Starving till he stops snoring. Hello, doctors. Why do we get stiff knees, or is it simply a blessing of a certain age? Well, no, it's not necessarily a blessing of a certain age. If you look after your knees and your joints, but people get stiff knees because they haven't looked after their joints. And the same, you see a lot of people going into their, I would even say into their 50s and 60s, which is ridiculous really, but they knee replacements and hip replacements and all these things are very common now, and arthritis and all of those things. So we need to look after our joints like we need to look after everything. And we have a webinar on arthritis that you can look at, but certainly massage would be a good thing for the knees. Probably sooner or later, but the later the better would be my opinion on these things, but so it is a blessing of a certain age, but that age would be quite high, I would say, maybe going into your 90s as opposed to going into your 60s or 70s. But there are things you can do, so you could look at that video on arthritis. Any help with sleep apnea, please? Nahid, do you want to take that one?
Nahid's recommendation, Dr. Nahid's recommendation, nasal drops.
Nasal drops.
And the
breathing exercise, nasal drop, this can help, especially the kapal bhati. What do we call kapal bhati in English?
Your fire breath.
Fire breath.
Okay, fire breath, and there are channel like nadi shuddhi kind of pranayama, like alternate nostril breathing.
Yeah.
This can help to clear the channels. And obviously oil pulling is just a wonderful thing. It strengthens your eyes, it strengthens your vision. So start doing that. Just two pump of the MP6 skin, and a lot of your sense organs are going to be covered with just nausea.
Okay. So is there any type of oil we recommend for oil pulling for kapha types? I presume it's probably sesame oil.
Sesame oil.
Yeah. Okay. And Sally Hayden under that says she's been oil pulling for 6 months and the dentist was very impressed. The teeth are stronger in the jaw and the bone, less reduced. Yeah. Okay, I'm after losing my place here. Is it safe to ozonate your fruit and vegetables?
You can do that if you want to. Yeah, it is safe.
What is it, Dr. Regina?
It is just some kind of, people are now into this ozone and oxygen therapy, that kind of stuff. It's just kind of antioxidant, like the fruit and stuff get oxidized very easily. So I guess it's increasing the antioxidant rate to your fruits and vegetables.
And how do you do it?
Probably there is some kind of equipment she has. Maybe Renu, you can tell us more about it. How
do you do it, Renu? How do you ozonate your fruit and vegetables? Doesn't sound very. I'd have to take a close look at that one. But eat them fresh. Eat your fruit and vegetables fresh. That's the thing. I mean, the minute your fruit comes off a tree, the nutritional value starts to go down. Same with vegetables when you pick them. So get them fresh. Get the fresher the better, and you won't need to ozonate them. But anyway, maybe you could share that a little bit more. What causes eye cysts, and would a tablespoon of trifla powder soaked in water overnight and used as an eye wash in the morning be good to bring down an eye cyst?
This is mostly a kapha kind of situation. So I would say, rather than going with eye wash, prepare a decoction of trifla wash, trifla powder quat, like a decoction, and then take a dropper and just try to have like maybe 2 drops or 3 drops in each eye twice a day. That can, we have done a webinar on the eye, nose, and eye ear care. So I have discussed like a lot of remedies which you can do at home to manage the cysts, and like the like chronic kind of situation, like which can be manageable at home. So prepare decoction. For decoction, you can take maybe 50 ml of water and take I think 5 grams of triphala and try to reduce it to like 1/4 of the quantity, and let it cool down, and then you can, with a dropper, you can just put it into your eyes. That can help to reduce this.
Excuse me.
And stop rubbing your eyes. Like a lot of client, a lot of patient in the OPD who kind up in the OPD, they are like keep rubbing their eyes because of straining. Stop rubbing your eyes. That that weaks your vision, and that produces a kind of bacterial infection. Cysts can a lot of things. So stop rubbing your eyes. Stop touching your eyes with dirty hands and all.
Okay, a lot of things coming up about eyes this evening. Bridgine McLaughlin, my daughter has an itchy rash on eyelids and lip, starting now also on the back of neck. Don't know if it's psoriasis or eczema. She only gets 3 hours broken sleep she only got, I presume, 3 hours broken sleep for a few years. Has already tried blissful sleep and hasn't made any difference. Yeah, 3 hours sleep is not anywhere near enough. So she needs to address that issue, whatever that's causing, because her immunity is just going to be shot if she's only getting 3 hours sleep. So that's going to give rise to all those other conditions that might come along. I would say that's the most important issue she needs to address, is she needs to address her sleep. So I would send her along to the YouTube channel, take a look at Dr. Brennan's video on sleep. It's not just about taking tablets. In actual fact, there's many other things we can do before even taking tablets, but she needs to get that issue sorted. I presume it's basically the same things about the, sorry,
I think she's not sleeping because of the itch.
Itch.
Yeah, sleep keep her awake. So it's not the problem with the sleep, it's the itch. So
yeah, I didn't read that from that, but anyway, maybe you're right. I'm not too sure if that's, I don't know which is the horse or the cart, or the cart or the horse, but anyway.
That might be like some kind of dermatitis or something. So you need to consult some of the doctors, one of the doctors, and
yeah, it's definitely something that needs to be addressed. You could be right, Rajvinder. I read it the other way around, but anyway, yeah. So I would advise her to get a consultation. Bridgine would be my advice in that. Do the doctors think alma powder would be better to take than vitamin C? And how much of it would you take it with ghee? So I don't know. Yeah.
So of course, amla powder is much better than taking vitamin C. But again, you should be regular with taking amla powder along with ghee. But we should also know which prakriti you are of. So it depends, like if you are a pitta prakriti or a vata prakriti, yes, along with ghee should be good, because amla is a rejuvenating herb. So it can be taken by all the three the dosha person. But again, particularly with pitta and vata predominant in you, you should go with amla powder along with ghee in the morning time. Basically, it should be taken empty stomach, mix that powder with the ghee and have warm water along with that. So that gives a good benefit, and you should take it for like around 6 months or an year to get good benefits out of it.
Or you can also take Chyawanprash. Chyawanprash, the
Yeah,
main
Chyawanprash.
ingredient of Chyawanprash is amla. So Chyawanprash is a very good source of vitamin C. You can go with that.
Yeah, and it's an all-round
have-
Rasayana as well, so it might even be more beneficial to take Chyawanprash. Yeah, it's an all-round Rasayana. What is the Ayurvedic recommendation for hemorrhoids? We do have a specific group of herbals for that, MA214, I think it is. But I mean, there are other things. I
Mainly
don't know.
your bowel movement, just bowel
Yeah.
movement should be good, no constipation, and a good texture and good time of passing the stool. Keep yourself hydrated. And if they're bad, like bleeding, we have herb for that, yeah.
Yeah,
And
MA214.
hemorrhoid is a condition where vata, pitta, kapha, and all the 7 tissues are involved. So this is not a very simple kind of situation, like, condition where all the tissues and all the doshas are involved. So get a consultation done, get your body type assessed properly, get your doshas, like which doshas is causing the hemorrhoids, whether you're bleeding more, whether you have the swelling more, whether you're constipated more, and then start taking something.
Yeah, because Dr. Nahid is right there. Like bleeding would be a pitta thing, and if
Yeah.
constipation would be a vata thing, and the swelling would be a kapha thing. So there can be lots of things causing it, but it's very, very uncomfortable. So it's probably best to find out exactly why it's happening in the person, whatever person it is, and then taking it from there. Artie, how to avoid acid reflux and heartburn? They're all pitta things, that's all to do with your diet. It's all to do with the way you're eating and the foods you're eating. And if you're eating, you need to, if you're eating anything and it's giving you acid reflux or heartburn, then your digestive fire is completely out of balance. I think it's called Tikshna Agni, the too much pitta, but if it's just specific foods that are giving you acid reflux, like maybe bread or cheese or something like that, then you just need to avoid them. But either way, it looks like you need to strengthen your digestion. You can take tablets to help deal with the thing itself, like MA575, ACI balance, or MA630 if it's very pitta. But again, sorry,
Avipatika churna.
Avipatika churna as well. I mean, the acid reflux, I get it. I walked the Camino Way a couple of years back, and I absolutely loved it, but the food was atrocious. All you could get in the morning was bread and cheese, and I'd start walking, and half an hour into the walk, I'd be getting acid reflux because that food didn't agree with me, and it's very, very uncomfortable, especially if it lasts for any length of time, But if you're getting it in the morning from eating breads and stuff like that, then switch over to stewed fruits. They won't give you acid reflux,
Stop having.
Sorry,
go ahead.
Yeah, alcohol is something that's going, and it's all pitta related, and if it's very pitta related, then MA630 is probably the tablet to take. But tablets are only a short-term thing. You really need to address your digestion, So, okay. Is anything? Do any of the doctors want to add anything there?
Yeah, if you're having tea or coffee in empty stomach straight in the morning, stop having that. That causes a lot of acid reflux. Even if you're having tea or coffee just after the meal, stop having that. And there were like a lot of question about the skin diseases today. So I just want to address that incompatible diet. So I have seen like people like kind of in Instagram and everything, they're just putting a bowl of cereal with milk and nicely decorated it with raspberries and strawberries, and like the caption are like healthy eating or healthy food kind of stuff. And I just see and I feel like to like just DM that person and telling them that no, this is not a healthy diet, you're eating an incompatible diet. So skin diseases are mostly related to your incompatible diet. Check your diet, whether you're eating dairy and fruits together, whether you're having, like, some people have like a spoon or 2 spoon of curd along with any kind of khichdi or like any kind of porridge kind of stuff. So stop taking the incompatible diet. That reduces your skin problem a lot. In fact, in the summer season, the inflammation and the skin rash is like on its peak, and if you keep taking all this incompatible diet, that might lead to eczema like psoriasis or any kind of skin disorder. So it's just that try to avoid incompatible diet. We have discussed this so many times. So
Difference between a Himalayan rock salt and black salt. Rajvinder, maybe you want to take that one. Pink Himalayan rock salt and black salt.
Yeah, the Himalayan salt is a lot, like a more kind of a unrefined, coming from the Himalayas, from the rock. And it's the same. The black salt is same Himalayan salt, but it is barbecued Himalayan salt. We can say it's a sulfur content got raised in it, so it's more medicinal, the black salt. So because some people, it put off some people because of the strong smell of it. So but when you put into cooking, it, especially people with digestion problem, a lot of bloating going on, and they have low hydrochloric acid, and the food breakdown is not happening properly, so they use black salt for cooking. But on the regular basis, Himalayan salt is better because it has more microminerals in it than the ordinary salt. Celtic salt, similar thing. It's just like a sea salt, which is again more amount of microminerals. So you come from western side, so more Celtic salt is more kind of local to people in the west, and Himalayan salt is more local to people in the east. But no harm using both of them.
Will the sea salt have as many microminerals as the Himalayan salt?
If it's not refined, if it's unrefined, then yes, it would have. But Himalayan salt has a bit more. I think it's 78 microminerals in the Celtic salts, and it's roughly a bit more, 90% or something more. And I slightly here and there. So but Himalayan salt has more microminerals than the Celtic salts.
Oh, there's a question there. Where do I start if I have Vata and Pitta very out of balance? Lifestyle and diet. Thank you. Probably, yeah. Well, you probably, when you start with the Vata, you'll get the Pitta back into balance anyway, you know, but it depends on what the major condition is, you know. So if the major condition is anger or inflammation or something like that, then you need to work on your Pitta. If the major condition is worry, can't sleep, getting thin, arthritis, anything like that, then you need to start on your Vata. But Vata is the king of the doshas, and it drives the other ones out of balance. And when you tend to get your Vata into balance, the other ones can come back into balance anyway. So Vata means you need a good night's sleep, your main meal in the middle of the day, and all of those things are going to help your Pitta anyway. So I don't know, do any of the doctors have any comment on that?
Yeah, you know, you're right. If it's Pitta, anger, and all of that, but if it's digestion, a reflex going on, or diarrhea, anything to do with digestion, definitely need to do the diet. But diet and lifestyle both are important side by side. Like if there's a stress, digestion is kind of doesn't happen properly. So you need to meditate to calm down your gut, because mind and gut connection go side by side. So lifestyle help the mind, and food help your gut. So they both are important. But again, all is right. Depends on what is more dominant, which one you can do first. So I guess no harm going for a fresher walks just for the lifestyle purpose, and starting your main meal in the middle of the day and go to bed on time. Even if you just do that, that will be beneficial.
Okay, so apart from snoring, is there anything wrong with sleeping face up? Is it best to sleep on the right or the left?
Any of the side is fine, right or
okay. I'm not sure there's any. Is sleeping on your back frowned upon other than the snoring thing?
yeah, that puts pressure on your left inferior vena cava.
Oh, that's a very precise answer. Thanks very much for that one. There's no arguing with that one. So we don't sleep on our back because it puts pressure on your what?
Inferior vena cava.
Okay, the
One
inferior.
of the arteries that supply blood from heart to the lower part of the body.
Yeah.
Very good. I often fall asleep when watching a film TV. What might be the reason for this? You're tired, Mary. That's the reason for it. Are you watching this late at night time when you should be in bed? This is what happens, you see. There's a
Maybe
natural
this
inclination to
evening.
fall asleep at 10 o'clock at night, and then something stupid comes on the TV and you say, oh, I'll have a little look at this and see what happens. And normally it's people running around shooting each other or something like that. And then by 10:30, you're wide awake and as opposed to having gone to bed. But if you're just falling asleep, and I don't know when you're watching the TV, if it's in the middle of the day, I don't know. I don't know whether it's a great idea to be watching TV in the middle of the day anyway, but it's just tiredness, Mary. That's it. You're just not getting enough rest. If you're falling asleep when you shouldn't be, then it's just a matter of getting your sleep pattern back into. What oil is the best to massage a swollen, stiff, painful knee, please?
So we have that joint soothe oil, and even Dashamul oil also we have, right?
Yeah.
On our website. So
Yeah.
Dashamul oil is a good option to, you have to warm that oil well, and then whichever knee is swollen, you can just apply it in a circular motion gently, and then you can just pour hot water over it, or if you have a hot water bag at home, just keep hot water bag on that part, so it will help to reduce the swelling on the knees.
Okay, so the name of the nasal drop, so that's Dashmula oil, and maybe just reply to Amber there if you could, Dr.
Yeah, I'll do that.
And the name of the nasal drops, please, for sleep apnea is MP16, also called MA735. George Hollis, is there a reason why the video of the doctor's talking isn't working? I don't know what you mean, George. Which video is it? The one you're looking at now? It seems to be working fine here, so maybe you could just give us a little bit more detail on that. Can I use coconut oil for oil pulling? I think you can, but yeah, you can, but sesame oil is the one, I suppose. Coconut oil for oil pulling, Richmond?
If you're pitta, then yes, because coconut oil is antifungal. If there is any fungal infection or anything, then coconut oil is better than the sesame oil.
When is our next detox? It's in the autumn. I asked Dr. Brennan to give me dates. You're also keen to go back on your detox again. That I had a few people email me about the autumn detox. So it's great to see people that are doing it twice a year, and people are getting. I think it's one of the most powerful things we do, actually, is that obviously consultations and individual programs are great for people, but the detox has there's a community feel about it, and people definitely seeing everyone encouraging each other to do the right thing and everything. So it definitely seems to bring great benefits. Can you remind us how to do the oil pulling, please? Just put some spoonful of oil in your mouth and swish it around and hold it in your mouth if you want. You can gargle with it, but you don't have to. Just hold it in your mouth and then spit it into a tissue and put it in the bin. Very simple. Must one oil pull after tongue scraping? Is there routine tongue scrape first, then brush teeth, then oil pull? I brush teeth, then scrape my tongue, and then do the oil pulling. But I suppose there would be no harm in scraping your tongue first and then brushing your teeth and then doing the oil pulling. But I'd certainly scrape the tongue before I do the oil pulling. How can I treat impetigo? From Lorna.
I definitely need a consultation for that.
Consultation. Okay, so Lorna, it's not something that we can handle on that.
It could be very much of a kapha condition, or it could be a pitta condition, depends. But anything like a detox pitta, you can start that. MA1663.
Okay, so Renu came back and she said, I have a small ozonator with a pipe that goes into the water that is used to wash the fruit veg. It's also supposed to get rid of any harmful organisms. Renu, I can't really answer it because I don't know anything about it.
Yeah, it's just to kill the microorganism and just stop the ripening of the fruits. So I guess it's no harm if you're doing it, but yeah, it's better, as I said. Yeah, buy the fruits. Nowadays, yeah, if it's organic, you don't need to do that. But if it's not organic, then yeah, there could be a lot of wax, or I'm not sure if it removed the wax though from the fruits.
Actually, there's an article in the paper today about the level of pesticides on fruit and veg, and even though the European Union had promised that they were going to bring it down, it's actually gone up. It's in the Irish Times today. Very, very good article. It's incredible what's on your fruit and vegetable. It's just incredible. They take pears from Belgium, and there was 5 different carcinogenic toxins on the skin of the pear. And it doesn't matter if you wash it because it's sprayed on the fruit right throughout its life. So it's like putting stuff on your skin. It goes into, you know, if it can be fat soluble, it goes in, it's in your bloodstream. So the fact that you wash it or peel the fruit is, you know, might get rid of some of it, but it's not going to get rid of all of it. But the amount of pesticides and chemicals that are known to be toxic to human beings is just incredible. I mean, how, like, we will look back at this in, I don't know, maybe 50 years or 100 years, and people will be going, you did what to your food? You took chemicals and you sprayed it on your food and then you ate it, and this was allowed, this was legal. Like, it's a form of collective madness, you know. But so if you can get organic fruit and veg from a local grower, definitely get them, because you're just, if you're eating ordinary fruit, you're just taking toxins in with it, and there should be no need for doing that, you know. So what do you recommend for a sore throat? So Rajinder, if you want to take that one.
And we have throat soup syrup. Brilliant. Just take half a cup of hot water, put a teaspoon into it and drink it as a tea, because it has camphor, and with hot water the camphor gets released, and as you're sipping it you actually feel it soothing your throat. So it's a brilliant one. And then there are tiny little throat soup pills as well, which you can keep sucking by keeping in your mouth.
So Florence is asking about, yeah, well, throat soup syrup and the pastilles, they're both on the website, you know. Any suggestions for eczema patches on the face, temples, forehead, eyelids, and around the lips?
She said it later as well, that she has to pacify pitta. So you're right. You don't know how. Florence, from your history, I know there's a lot of food, vata, pitta. So I think you are going in the right direction. So keep going. Hopefully, slowly, with all the stuff you're taking, it will start balancing. Yeah, I have you on already pitta pacifying herbs.
Okay,
You can
Rajvinder.
start using the skin soother oil if you don't have that. So MA350 skin soothing oil, you can put in the night time before you go to bed on those patches.
Okay, so can you please guide the right way to do oil pulling? We just did that a minute ago. Can you take a large powder with aloe vera juice? I'm not sure. What's a large powder?
Okay, yeah.
It's just some kind of powder. We were talking about amla powder. Don't know what large powder is, but any powder, aloe vera is a good carrier. Yeah.
Okay, so I hate to say I told you so, but Bridget says the rash is only recent. The sleep problem has been for a number of years. So yeah, you need to get rid of that sleep problem. That's and probably the rash problem will even solve itself if you get rid of the sleep problem. But so hemorrhoids. Sorry, Raj.
Just need to talk to the daughter. We can't just say how to.
Yeah, she should have a consultation, Bridget. Consultation. Just go and have it. It'll be well worth her while to have a consultation. You can't carry on like that, you know. Breda Murphy says hemorrhoids caused by constipation, which is sparked by taking iron for low hemoglobin levels.
Change your brand forever, for sure.
Any idea what we can take for that low hemoglobin levels as opposed to iron?
Yeah, because iron tablets usually cause more of constipation. So that is one of the things. So you can go through the constipation webinar, which is done last time. So there are quite a lot of home remedies like prunes and pomegranates, and you can include few semi-solid food in your diet to get rid of constipation. But hemorrhoids, yes, you need a consultation so that we get to know what type of hemorrhoid it is.
Also, I'm wondering about the iron. I mean, would MA600 be a better option, because it helps with iron absorption, and it mightn't cause that. It mightn't cause the constipation.
Yeah.
Are you familiar with it, Raj?
Yeah, definitely, Breda. You can take that. But if your iron level is very low, then if you're taking Galper or something like that, you need to change it to a liquid iron, which is Flurdex, or gentle iron. Solgar is very good one, doesn't cause constipation. So do consider changing the brand, because they could be very harsh on your system, especially the strong Galper ones, that normal pharmaceutical one. So
you can take psyllium husk when you are in iron supplement at night.
Psyllium husks.
Yeah.
Okay.
That prevents constipation.
Yeah, that could help as well.
Or Triphala even. Yeah, take Triphala.
Yeah, Triphala definitely.
Triphala tablet should be a good idea. Is Chapmanprash okay for a post-detox for Cyana? Absolutely. Instead of Amaret? Yeah, absolutely. No problem. Is it okay to put Chapmanprash in porridge in the morning?
Yeah, that's
know?
fine. Why not? Yeah.
Is it
But
okay?
porridge, only thing, there should not be milk in that. If it is like
Yeah.
in the water, then okay. But don't mix chawanprash with milk, because it has amla, and which has sour taste into that. So it is considered as incompatible food when you mix the sour taste with the milk. So try to have it along with warm water, better.
Okay, so oh my God, we've 85 new messages here. How are we doing for time? 20 down. I was saying there wasn't any questions. How should I take Chyawanprash morning and evening, a spoonful? But I think the directions are on the thing anyway. Rajvinder, speed it up a bit. Okay, Rajvinder, early morning on an empty stomach. Naheed, what's the best oil for massaging the feet again? Sesame oil is fine. George Hollis, pictures are all still. That's your computer, George. I don't think it's anything to do with us. It's your internet connection. Thank you, Dr. Naheed. I have to leave now, but thanks for the interest, and that's okay. Dashmula oil, that's okay. Alison
Any
asked
update on the
business.
yoga class and 30th, 31st or 30th? We said 31st. Noel is going to announce that. Yeah, you will.
Okay, I'll send out a link to it. We missed the question. Thyroid issues lead to greater desire for salt. Okay, I'm not sure. Okay, they can, yeah. What is the best time to have banana, and can it mix with milk? Definitely not in a smoothie with protein powder. No, you can't mix it with milk, and fruit is best taken on its own nearly, you know. So
Yeah.
bananas are very heavy. So can you clear
and that's also
intolerance?
Dr. Chitrali, what she said. One is sour and one is sweet, so it is incompatible. So lots of people do that, but it comes under incompatible food combination, banana and milk.
Dear doctors, can you clear intolerances to food through Ayurveda practice, and how long does it take, do you think? Thank you. Absolutely you can, but it depends on how long the condition is there. It's allergies. Again, come on and do Dr. Chitelli's webinar on allergies, and you know, it's about purifying your system, but there may be some things you're allergic to and you're just going to be allergic to them for life, and that's it. But in a lot of cases, that's not the case. It's just an imbalance of your system, you know. So Francis says, my back is giving me pain, which happened very quickly. It appears I twisted it while bending the other day. Can you recommend any help? Naheed, you were a specialist on back pain.
What was that? My back is giving me pain, which
it's twisted a bit, so it's causing pain.
Okay. So I hope there is no fracture or there is no dislocation. Apart from that, you can do a oil massage with herbal inhalation oil and followed by a hot water bottle compression that helps to reduce pain, that relaxes your muscle, and a little bit of, you know, just like a gentle movement of that part, like maybe like just doing like this and like clockwise and anti-clockwise can help to relax your muscle and reduce your pain.
Okay, an MA634 and rest, it's all, and then get it checked out as well, you know. I thought that we should scrape the tongue first before brushing or oil pulling. You should definitely scrape it before oil pulling, that's for sure. So as to get rid of the obvious ama initially, rather than start mixing with the gums through brushing, etc. I thought scrape, pull, and then brush. I would go scrape, brush, and then pull. But it's up to you. It's up to you. But you know, you could scrape the tongue. I wouldn't do the oil pulling. I'd scrape the tongue first. That's the first thing, you know. Or you can brush the teeth as well, and then just scrape straight after, and then do the oil pulling, you know. Okay, banana and yogurt, okay or not? I would say not. Thank you for all this wonderful knowledge. Okay, Janice and Robert, thank you for coming on and listening to us. Can you take fruit stewed in hot almond or coconut milk? I don't see why not. Any comments from our food specialist there, Rajvinder? Are we okay with fruit stewed in hot almond or coconut milk?
Yeah, non-dairy is fine because it's just kind of, coconut is a fruit.
And Naheed answered that question. Yogurt is dairy, so it's a big no with fruits. Is it okay to use non-dairy milk like coconut milk to make a banana smoothie? Yeah, possibly. Non-dairy milk, make a smoothie. Are we okay with that?
Yes, I'm sorry.
Yes.
Okay. Actually, I think I've got to the end. Actually, I think I have got to the end.
Yes.
Then, yeah, wow. I actually was showing up 87 messages, but there must have been messages we'd already dealt with, you know. Fantastic. Wow, we covered a lot of ground in tonight's talk, you know. So just to let you know about a few things coming up, and obviously Dr. Tritelli's webinar is going to be coming up on the 8th of June on allergies. So, you know, if that's an area that interests you, then take a look at that. I'll go back to the questions now in a second as well. Another thing is we're going to be doing a special webinar about the new courses we're going to be offering in the autumn. And it'd be great if everybody can come on to that. We want to get 600 or 700 people coming on to that webinar. It's about new courses that we're doing. We've been sitting down, the doctors, we've all been sitting down and going through what we feel we can offer to people in different levels. And this might be an area where if you want to go into Ayurveda, you know, to start making a living out of Ayurveda, to get qualifications to do things. And there's so many different areas you can go into because Ayurveda touches so many different areas of life. So we're going to be taking a look at that, and I'll be organizing that in the next couple of weeks. I'll be sending that out. Now, the other thing is that I'll send you an email about this, but I'll just let you know about it. All of the webinars that we've done, that we've recorded, like we've done brain health, we've done thyroid, we've done arthritis, we've done diabetes, we've done constipation, we've done ear, eyes, nose, and throat. We've done, Rajvinder has done lots of cookery ones. We're going to be reducing the price of all of them over the summer. I think they're going to be about €10 each. And so that'll give you a month's rental to rent them for a month, so you can go over them again and again. The other thing I'm going to do is I want to start getting this knowledge out to, I mean, it's great that we have this group and I recognize the people, and any new people that came along tonight, it's fantastic to see them coming along, but we need to get more and more new people interested in Ayurveda. So one of the things I'm doing is I'm running ads on Facebook at the moment, and what it's doing is just to get people interested in Ayurveda. We're giving them free access to the arthritis webinar. That's the first one I'm going to start with, you know. So we're saying to people, like, sign up for our newsletter and you get free access to the arthritis webinar. And hopefully, obviously, I'm just gearing that towards people who are suffering from arthritis so that they can become aware that there is another alternative to what's been offered by Western medicine. And then I'm going to do the same with constipation, with ear, eye, nose, throat, all of those things. And what I'll do is I'll make those webinars available to you for free as well. And what I want you to do with that is you can feel free to send a link where you can register to your friends who may have arthritis and say, this is a video by Dr. Brennan, Dr. Rajvinder, and whoever are the other doctors, and it's 2 hours long. It covers all different aspects of arthritis. And maybe if you're interested in this, you can take a look, because we have to get people interested in this. They have to start knowing what the Ayurveda is all about, because even though we all know what Ayurveda is about and we know the depth of its value and what it can do, most people really, I mean, if the average person going down the street and you ask them what Ayurveda was, they wouldn't even know what it was. And the ones that did know might think it was massage or might think it was yoga or something like that, but they wouldn't know the depth of knowledge that's contained in it. And really, that's what we need to get out there, is that depth of knowledge. So I will send you an email about that. You will have free access to the arthritis webinar for about a month. I will be running those ads on Facebook and Google and on YouTube. If we've any digital marketing experts among our family, then definitely get in touch with me if you have any ideas about how we can promote this knowledge, you know, through digital marketing more efficiently, because everything costs money. But I mean, we have money to spend because, you know, we've been doing very well for the last year or so with all the increased interest in Ayurveda. But I want to ride that wave and get more and more people interested as well. So as I say, if there's any people out there that are experts in digital marketing, if they can get in touch with me. So I'll be in touch with all of that. Any other questions that came in that we need to?
No. Sonia is going to ask her some. Okay.
Yeah. Someone has asked. Sorry.
Oh, sorry. The webinar will be recorded. Yes.
Yeah. So the webinar will be, there will be a recording for 1 month, so you can watch it anytime later. Someone has asked about allergy webinar. Will it be possible?
Oh, recorded. Absolutely. What happens when you do any of our webinars is, because there's so much information in them, we know people can't take it all in. Like the average person's attention span is about 15 minutes, you know, so we know people can't take it all in. So we always make the recording available for a month afterwards. So, and if you rent any of our webinars on our website, you get access for a month, so you can just watch it in your own time as often as you want in that month, you know. So the same thing will happen with the allergies webinar. You'll have access to the webinar for a month, you know. So someone is asking about vegan recipes. most of our recipes, if you just swap out ghee for coconut oil, will be vegan. We don't tend to use very many animal products in the recipes, except maybe honey. You just leave out the honey. Instead of using ghee, you use coconut oil. And generally, most of our recipes will then be vegan, you know. So it's, and Dr. Rajvinder, I think, is going to do, like, we have 4 cookery courses on the website, you know,
Lots
and
of
maybe
people
we're
are
going to do some
asking.
more. You know.
Lots of people are asking. Everybody's saying, I'm in. So need to think about it now.
Great idea to use some of the webinars to promote Ayurveda. Yeah, okay, that's great. Okay, I just want to say a big thank you to the doctors. We missed Dr. Brennan tonight, but I think the other doctors did fine without him, and he was on another webinar, so hopefully he'll join us on the next course. I'm going to try do a celebration on the 21st of June, because we didn't have one in March, because I think I was in Mexico or somewhere like that. So we'll try have a celebration on the 21st of June for the summer equinox, you know. So no, sorry, the summer solstice, the longest day of the year. Yeah, sorry, solstice. And yeah, so if any of you are interested in singing a song or saying a poem or anything like that, okay, thanks, Sonia. Then just drop me an email, but I will be sending out an email about that as well. Oh, another thing, Dr. Rajvinder is going to be doing a webinar on the menopause. That came up at something we did recently, Rajvinder. What were we on that it came up?
Yeah, on detox.
On the detox, lots of people were asking about the menopause, and so we're doing a webinar on the menopause. I don't have the exact date, but it'll be sometime towards the end of June. I think
24th of June or something.
Yeah,
like
something
that.
around then. Anyway, I'll send out the exact date about that, but that's one that should get a lot of interest, you know. So yeah, that's it. So I'm not sure if thanks a million to all the doctors for coming on, and I don't know if any of them have any final words they want to say, or if they're happy to.
Well, thank you so much we didn't expect the number. It was, I think, 107, and wonderful questions. Thank you for your ongoing support. It's really, really beautiful, the sense of family and community here. Really grateful to you all, and happy to see that you're applying the knowledge and getting benefit from it. So great, well done.
Thank you, everyone, and have a good night.
Yeah,
Thank you. Good night.
Yes, and just one last thing. Florence says, Alison, I thought Dr. Naheed said dairy and fruit are not compatible.
Oh yeah, that was in relation to someone was suggesting dry fruits, I think. So they clarified it later.
Clarified that. Okay, let's just go down, go around. Mahagat, Antoinette there. Yes, thank you very much, Antoinette. Good to see you on. Very interesting webinars. Don't forget to tell all your friends. That's the best way to spread this knowledge. Just tell your friends about Ayurveda. You can share the link with them for the Q&As. Just don't post it on social media, because then it's out of our control who comes on the call, and you could have people with bad intentions. So but certainly your family and friends are welcome to come on the call and ask their questions, you know. So big thank you to everybody. Namaste. Have a great night, and we will be back in touch with you for our webinars and for our celebrations. Okay, everybody, take care. Bye-bye.
Bye.
Bye-bye.
Bye-bye.